let's bring in ABC News medical contributor Dr. Darian Sutton. Dr. Sutton, let's talk about Johnson & Johnson. Their emergency use authorization could come as early as Friday, we're hearing. So what did the FDA say about that vaccine today?
Well, Terry, this is exciting news. So the FDA first reestablished what we already know, which is the levels of efficacy. Overall, it seems that the Johnson & Johnson vaccine has a 66% efficacy in preventing symptomatic disease, but more importantly, 85% in preventing severe cases and 100% in preventing hospitalizations and death. The EUA the basic clearance for the EUA authorization came as they were able to approve that was also safe, specifically when looking at other groups, including age, race, ethnicity, medical comorbidities, and any patients with prior COVID-19 infection.
So that's another vaccine coming online. Here in the U.S., Pfizer, Moderna vaccines, they're the ones mostly being currently authorized. They're currently authorized, and both of those are two-dose vaccines. You get two shots. So the J&J vaccine's just one dose. How important is that?
Incredibly important. This would eliminate a significant factor that contributes to distribution delay. Not having to follow up with an additional dose allows us to vaccinate more, especially the fact that Johnson & Johnson vaccine can be stored at more regular temperatures. That allows ease of distribution, but also some storage. So it really is a big deal.
And so people looking at the vaccines out there, they might want to try and choose. Should people feel comfortable taking any of these vaccines if they're approved? Is one better than the other, do you think?
My recommendation is to get the vaccine that first becomes available to you. There have been no comparative studies comparing the Moderna and Pfizer, which already have emergency use authorization, to the pending emergency use authorization of the Johnson & Johnson vaccine. And we also have to understand that the J&J vaccine was studied under different conditions. It was a specifically different time point, also in the setting of these new variants that are likely more transmissible, as we talked about, in the variants found in South Africa. But what we do know is that it's 100% effective in preventing that hospitalizations and deaths. So my goal is to prevent patients from presenting to the emergency room and meeting me. So get what vaccine is available to you first.
And Dr. Sutton, there's been a fair amount of frustration with the vaccine rollout, people trying to get through the system, trying to get a dose. Johnson & Johnson saying it can deliver 20 million doses by the end of March. We're now looking at some significant volume. How much impact will that have increasing the rate of vaccinations?
Having the addition of the Johnson & Johnson vaccine could bring up our daily vaccination doses to above 2 million per day, which would allow us a more clear path to getting to that vaccine-induced herd immunity that we're hoping to get to this summer. So I think that, yes, we have to be cognizant of the issues with distribution and the physical effort that we have to put into making sure that the operational factors that allow us to distribute this vaccine are in place. But having the vaccine with Johnson & Johnson, in addition to the Moderna and the Pfizer vaccine, are going to be an incredible asset to our tools against COVID-19.
And then let me get your opinion for those who have been vaccinated, the millions, including my in-laws, who have had the vaccination. Dr. Fauci said the CDC is going to release more guidance soon for people who are fully vaccinated. So what's your advice to that group? Do you think the virus can be transmitted through people who have been vaccinated to those who haven't?
I'm asking the same question as I've been fully vaccinated, and some people in my family have also been fully vaccinated. We're still waiting on the data. What we know so far is that the information available to us from Moderna and Pfizer and now from J&J are showing that the vaccine is preventing symptomatic cases. But we know that there is still a high level of transmission that occurs between asymptomatic and pre-symptomatic cases of COVID-19, and that is data we simply don't have yet. So until then, I advise everyone to do what I do, which is continue to practice the same mitigation efforts, which is wearing a mask and distancing as much as possible. And remembering the vaccine is helping us keep people out of the hospital, and masks and distancing are helping to keep transmissions low. Together, this will be our best effort, our best fight against COVID-19.
Great advice. Dr. Darian Sutton, thanks as always.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.